Hi, I'm really glad to be here, and I want to just tell those of you who are not familiar with Silent Spring Institute, the Institute was founded 20 years ago by breast cancer activists who were seeking to investigate environmental factors with a goal of prevention. Susan Santos was one of the founding investigators. So we are a public interest science team, and my constituents want to get the right answer as soon as possible. And to do that, we are both users of shared data and creators of data that we seek to share. So we are users every day of the National Exposure Report, which is part of the National Health and Nutrition Examination Survey. We use the online data every day as a reference for population values of exposure to a variety of environmental pollutants. We also have used the confidential data, gone to Maryland and sought permission to use county-level identifiers. In our own research, we found very high levels of flame retardants in house dust in California compared with Massachusetts homes. And we were able to quickly go to NHANES and show that California blood levels of flame retardants were twice the level of the rest of the U.S. These results are published in Environmental Science and Technology and contributed to a change in the California furniture foam flammability standard that was implemented in January. So this household exposure study has collected information on measurements on household dust, air, people's urine, and some blood samples for more than 100 endocrine disruptors and other pollutants. In California, Massachusetts, and Ohio, we are measuring some regulated contaminants. We sought an NIH certificate of confidentiality and a partnership with Harvard Law School to protect our participants. For more than 30 of our contaminants, ours were the first and still sometimes the only measurements indoors. So this is a nationally very important data set. EPA asked for access to our data to use as a basis for health risk assessments, and we sought IRB permission and permission of the Massachusetts Cancer Registry to share the data with EPA. Because we're interested in understanding the sources, thank you, the sources of these exposures so that they can be reduced. We've also collected information about building characteristics, pets and kids who run around tracking pollution in and out, consumer product purchases and practices, and remodeling, and all kinds of other information that might be related to sources. We would like to share our data set in EPA's ExpoCast, which is an online data resource, but we became quite concerned that the data might actually be re-identifiable. And that led us to form a partnership with LaTanya Sweeney at the Harvard Data Privacy Lab, Ruth Ann Rudell, who's the lead investigator on the household exposure study, and Phil Brown at Northeastern, a sociologist, are partners in an NIEHS-supported grant to empirically investigate the sources of privacy risks in environmental health studies. So we've looked at 11 major environmental health studies that have collected personal level exposure measurements to see what kind of data they include that might be vulnerable. And we're focused in particular on data that might be linked to real estate databases, property transfers, tax records, zoning kinds of records, data that might be linkable to professional licensing registries, for example, pesticide applicators in the Ag Health Study or teachers in the California Teachers Study. And then a category of data that we consider like things your neighbor might know, like what kind of fuel you have for your house, or how many pets, and when you remodel, things like that. So we propose to empirically evaluate the re-identifiability of our own data, and we have asked them, IRBs have approved this. However, the Massachusetts Cancer Registry has not. We're still talking to them about it. But so in order to generate empirical data about this question, we will need to continue that discussion with them and hope we reach a resolution. We also wanted to find out what study participants think about these privacy issues. And so we interviewed participants in the Personal Genome Project, which is an open consent study in which participants go through a training process and post their data on the web. These are not, people are not representative of people in studies, but they are really on the frontier of giving up their privacy for science and for public health benefit. There are also parallel efforts that we need to think about in the environmental world, like Patch Bay, which is a website where people can upload pollution data. And you may have seen a recent publication about wristbands that can collect pollution data. So these individuals may be making decisions about their own privacy, but they're also creating data that's linkable to research data, such as our own, that may be covered by informed consents and IRB control. So we're trying to solve three problems. One, what is our empirical knowledge about what could lead to re-identification in our data sets? Two, what are the potential technical solutions to that in terms of masking or synthesizing data or creating server systems that would respond to queries? And three, what can and should we promise to our study participants in the informed consent? And I want to just close with an irony that some of the research that we are doing is necessary as a kind of reverse engineering, because industry has been unwilling to tell us what ingredients are in consumer products and unwilling to share with us their own emissions monitoring from their own stacks.